First impressions are priceless.
I'm Dr. Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.
Hi, I'm Dr. Kenny Levine. Welcome back to Health Talk. Again, we're streaming live on the web at www.tvchannel19.com. I'm here with Dr. Abby Wilentz, one of my favorite pediatric dentists, a pediatric dentist to the stars. Five of my 7 grandchildren. Abby, in dealing with children, all dentists can treat children. Tell me a little bit about special training you had, and when a dentist says, I can't treat this kid, I want them to see you.
Well, our specialty, it's not only children, but dealing with a lot of the special needs community. So what makes our practice unique is with the general dentists who don't have their training, we have to go 2 years after dental school. Right. And if you want your master's, you go 3 years. And you get special training into dealing with children that general dentist feels like they would be better treated in our hands. A lot of the special needs community, or even if you have to do on a very small patient, or even a patient that has a lot of anxiety, our office, our training, we could sedate children.
You talked about young patients. With treating newborns and infants who have difficulty nursing, my youngest patient to date is 3 days old. Patient came from the hospital to my office from the recommendation from the lactation consultant. Of course, couldn't nurse properly. So that's pretty young. My youngest patient before that was about 8 days old. Before I got involved with doing tongue touches, my daughter Jen, she was 8 months old, and I cleaned her teeth when I was teaching at the University of Florida. Talking about age, when would you say, not a special needs child, a child who's doing well, when is the best time for them to first come see you?
Well, Kenny, it used to be age 3, but now the American Academy of Pediatric Dentistry, and it's supported by the American Academy of Pediatrics, recommended dental home by age 1. Everything's about prevention now, and a lot of trauma starts well before age 3 when a child starts walking, and a lot of injuries can happen. So at least if they bring them by age 1, not only can we guide them anticipatory guidance to the parents, meaning if they have any types of habits, either the thumb, pacifier, prevention-wise, we can also guide them trauma-wise. Right. So if a young patient comes to our office, if trauma does happen, when they come to our office, it's not the first time, so it's a familiar environment. But your point, Kenny, before is, as young, sometimes we get a call from pediatricians that sometimes an infant can be born with a tooth. And if it's mobile, sometimes they're afraid it interferes with the feeding, or they can aspirate it. So sometimes at the day after a baby's delivered, we're called in to see what we should do with it if a child's born with a tooth.
Let's talk about habits. Let's talk about finger sucking, thumb sucking. What can be done for that for kids today?
Well, being a mom and being a female, I'm not too aggressive because every child's born with this innate rooting reflex. That's how they know either to feed, either suckling on the bottle or the breast for nutrition. So they say by 9 months, a lot of the times the habit should go away on its own, and a lot of times with children it lasts a lot longer. Any habit, most of the time, any habit that dental changes that the habit makes on the dentition, as long as the habit stops before the new permanent teeth come in, it has no effect on the relationship with new permanent teeth.
Before the permanent teeth come in.
Exactly. So, and a lot of times the pacifier is a lot easier to stop than either a thumb or a digit habit. So if you take the pacifier away too early and the child's not ready, a lot of times they can develop the thumb or the digit habit, which is a lot harder to stop. So I'm not recommending a child should do it, but if they do it, I'm really a lot more relaxed probably than others. But definitely by age, pacifier around age 3 to 4, thumb a little bit older. But definitely when the child starts losing teeth, the habit should be stopped.
Okay. Again, we'll be back with Dr. Wilentz in just a minute. It's Dr. Kenny Levine, and we're streaming live on the web at www.tvchannel19.com. We'll be back in just a moment. Thank you.
When you're smiling.
First impressions are priceless.
I'm Dr. Kenny Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.